Hello, everybody. My name is Josh Caruso. I am the Assistant AD for Sports Medicine at High Point University. I want to thank you for taking the time to watch this presentation tonight, and um, we're looking forward to sharing this information with you. I want to let everyone know that I am recording this session so that anyone that may not have been able to attend will be able to see this. I'm going to send it out over the same on an email to the entire group as I did with the link for this. So if you're on the phone and you didn't get a chance to see the PowerPoint that I'm presenting, I'll be sure to get that to everybody. I also want to reiterate that the information we're going to cover is specific to July. We're not going to cover what the preseason in August looks like or what games or travel. We have plans for that. They're tentative at this point as everything is continually changing. So we will have another session at a later time to discuss those things. So if you have a student athlete that is not attending summer session 2 or coming early to High Point in July, if you want to step off, I would understand, but we won't be covering anything that will be going into August. If you have any questions, please type them in the chat box. The chat box is at the bottom left of the screen. It looks like a text bubble. I will get to as many questions as possible at the end of the presentation. If you're on a phone, I will give you my contact information when we get towards the end, and you can email me or call my office with any questions that you may have. I hope to have this finished up by about 7:45 this evening. And the last piece before we get started is some teams are making some sport-specific or facility-specific changes. I won't go over each of those in detail, but what I'm going to present will give you a good general guideline as to what's going on. These will be things everybody is following, but your students may report back to you slightly different things. With laundry, for example, they may not do exactly what I'm describing, but we've had discussions with those, and those slight changes are due to the number of washers that may be available, or the number of managers or coaches available to do the laundry. So there might be some slight tweaks there. The first thing I wanted to cover here was who this team was that put together these plans for your student athletes. Dan Hauser is our athletic director. As I said, my name is Josh Russo. I'm the assistant AD for sports medicine here and the NCAA healthcare administrator. Katie Yackel is a member of the sports medicine staff. Andrew Crossley is our head strength and conditioning coach. Jennifer Harvey is our medical director and works at Novant. Gus Porter is the university crisis management and emergency preparedness manager. Amber Kelly, she's our executive director of counseling services here on campus. Brian Moore is the assistant AD for facilities. Craig Cozart, he's our head baseball coach. Travis Howell and Jessica Buffkin both work in student health. Dr. Howell is the community health director for Novant, and he's also currently the medical director for student health here on campus. Jacob Crawford is our club sports AD, and Dr. Dan Erb is the senior VP of academic affairs. He's also the chair of the HPU Health and Safety Task Force that is implementing all of the policies and procedures for the general student population and what academics looks like. So what's next? What's our goal? What was this team's goal? Our goal is to deter the risk of spreading COVID-19. We know that if we set a goal of having 0 cases, that's just not realistic. And so we want to be able to prevent the spread as best we can. Our plan will constantly be being evaluated. We'll be updating as necessary to comply with new research, best practices, and any new laws that may arise. And our plan will be a living document. So things will be changing as new data comes out, as we see what our population looks like and how many positives we may have or what contact tracing looks like. Our plan will be adjusting to that, but this is where we're going to start when your students arrive back here on campus on Monday. What is COVID-19? I think everyone's familiar with this by now. COVID-19 is the infectious disease caused by the recently discovered coronavirus. It started in Wuhan, China in December of 2019. And what makes this so difficult to manage in our population is that this disease spreads primarily from person to person through small droplets from the mouth or nose, and you can get it from someone that's not feeling sick. So asymptomatic carriers can transmit this disease. Many diseases you have to be feeling ill or have symptoms before you can present it. Not here. So we're trying to take some steps here to prevent this spread in that manner. What are the symptoms of COVID-19? The big ones are the fever, cough, and shortness of breath, difficulty breathing. But the rest of these here, fatigue, body aches, nausea, these are also current symptoms as recognized by the CDC. There's new loss of smell and taste. Those are pretty standard. The universities I've spoken to that are already back on campus, the student athletes that they've had that have experienced this, that's pretty common. But you also see sore throat, congestion, and runny nose. This next slide is some branding that your students will see when they return to campus from the university. How do we prevent the spread? So on here, I know it's a little small, but they talk about washing your hands, disinfecting your area, covering your cough with your into your elbow, monitor your own signs and symptoms, greetings. We shouldn't be shaking hands or giving high fives, wearing a mask, staying informed, and most importantly, staying home if you're feeling sick. The days of I don't feel well, I'm going to push through this in athletics are over, at least in the short term, until we have a vaccine for this or a cure for this disease. So the gist of what we're trying to get to, what is athletics doing specifically for your students? Here's a list of some of the things we're doing. We will be utilizing 2 separate screens. The university will be screening our student population once per week, and athletics is implementing a screen daily. The athletic screen will be through our compliance software, so every student athlete already has access to that. In addition, we'll be doing daily temperature checks when they arrive to our athletics facilities. Face coverings are mandated in the state of North Carolina as of last week. So everyone, when they arrive on campus, will receive a face mask, face covering from the university, and they'll be expected to wear it to going to class, in the halls. That does not apply to when you're working out or exercising. You can take it off. But other than that, you're expected to wear your face covering while you're on campus. A few weeks ago, I sent an email to all of our incoming student athletes with health suggestions to help minimize their chance of coming here as asymptomatic carriers on July 6th. Things like limiting your exposure, washing your hands, wearing a mask when you go to the market, for example. When we have our students come next week, those that are flying in, we will be testing those student athletes 3 days after they arrive. So in general, on Wednesday, we'll be testing them. We've been told that is a 24 to 48 hour turnaround. We're waiting those 3 days to try to limit the number of false negatives that we get. As far as hydration safety, every student athlete will have their own water bottle for walking around, and they will have a separate water bottle for practice. My staff will fill the water bottles during practice, and they'll wear a glove to touch the coolers and the bottles. And when the students are walking around campus, the touchless water filling stations are available. However, the water fountains are not, so students will need to carry some sort of container in order to get water on campus, but that's why we've given them their own water bottle for walking around. Sweat towels, every student will now have their own sweat towel with their name and or number on it. We're going to encourage them not to share their towels, so they need to find theirs on the bench if that's something that they're looking for. We sent our physical paperwork last week with our COVID screens and questions related to high-risk conditions. We also sent another screen on Monday, and then we will have one more when they arrive next week to catch the last 7 days. Our return to sport after a positive test, we'll be following international guidelines. Currently, the return to sport is a minimum of 7 days after a positive test. So you have to go through your 10-day isolation, which we'll talk about here in a moment. But then once you're cleared to return to activity, you have another 7-day progression to get back to sport. For those of you that have sustained a concussion or have had students sustain a concussion, it's very similar in that it's a graded progression. It builds up over time. It becomes more intense. It becomes longer. It adds contact as we build on. Education. I've had a education session with the staff and coaches last week, and then I've met also at the end of last week with each individual team that will be here in July. So I've done these sessions with our staffs. I've done it with men's soccer team. I've done it with our volleyball team and our men's women's basketball teams as well. So what does phase 2 look like? This is what most of our students wanted to know. Currently in North Carolina, we are in phase 2 that has been extended to July 17th. Phase 1 for us, as a side note, is when you're quarantined at home. So currently we're already past that stage. So when our students return, they'll be doing their own self-monitoring daily. They'll be using we'll be checking their temperature. They're using their own personal hygiene products. And at practice, there'll be no sharing of equipment. So two student athletes will not be able to pass a basketball back and forth, for example. Our coaches, according to NCAA rules, if they can be there, they will maintain physical distancing of 6 feet, and they'll be wearing face coverings while they're at practice. No indirect or direct contact. We talked about not sharing a basketball, but this would also include if we had pole vaulting, for example. You can't pole vault into the pit and then another person pole vault into that pit as well. So no contact and no sharing of equipment. We will have, I'll use basketball as an example, they can shoot on the one basket by themselves. Then that area will be cleaned before the next student comes in and utilizes that space and that equipment. Once the governor allows us to progress to phase 3, the daily self-monitoring will continue. The temperature checks will also continue, as well as our use of our own personal hygiene products. But this is when we'll start to slowly increase the amount of contact that we have. Our coaches will still be wearing face coverings, and our participants may start to use each other's equipment. So this is where our first week may look like we're starting the very basics and we're passing a ball back and forth. From there, we can go into small-sided drills and then build up until we're playing what we all want to do at 11 on 11 for soccer or a full-sided basketball game. Some changes in sports medicine. Each athletic trainer will wear a pair of gloves when they are treating a patient, and then when that patient leaves, we'll be changing our gloves. The student athlete and the athletic trainer will wash their hands before and after treatment. There'll be no shared gels or creams. We've taken them off the countertops, so there will be nothing available for the student athletes to use in those regards. We do have some pump action type Flexalls, which will still be there, but my staff will pump it, and then the student can get the liquid or gel in their hand and apply it to themselves. We will be appointment based only for those that are familiar. The training room is usually a place to hang out and just pop in. We won't be doing that in the short term. Our student athletes and our athletic trainers will wear a mask while they're in the sports medicine center. For those teams that get taped, we'll have assigned taping time so that we can minimize the congestion and maintain physical distancing while we're in here. The weight room will have similar procedures. Everyone will need to be screened. If all they're going to is the weight room and not the training room, they'll be screened before they arrive in the weight room. They'll have a slow, gradual return to activity. We know many student athletes have not had the ability to train while they've been at home, so we're not going to go from 0 to 100. There will be a slow progression that is based on national guidelines and guidance. Every student athlete or group will have an assigned training time. They won't be sharing equipment. They will have assigned racks. They'll be maintaining physical distancing in the weight room, as well as practicing hand hygiene before and after they are in the weight room. We've enhanced our cleaning. Housekeeping will disinfect all common areas nightly, so training rooms, weight rooms, locker rooms, all of those areas, they are coming in between the hours of 5 and 7 p.m. Student athletes will not have access after 5 o'clock to those areas, so that these areas can be properly disinfected and dry overnight and be ready for the next morning. Sports medicine has enhanced our cleaning protocols. We are cleaning every piece of equipment in between use, so if a student athlete's doing rehab, they utilize a ball, for example, that ball will be placed on the side. We will clean it and it will be disinfected before the next person uses it. Strength and conditioning is upping their cleaning as well. They'll be disinfecting common areas more frequently. And in between group sessions, there will be time set aside to sanitize the entire room. So if a group, for example, is lifting from 10 to 10:50, the next group won't be scheduled till 11, so it'll allow them time to wipe down the entire room and disinfect before the next group arrives. Laundry and locker rooms, this is where you may see slight differences with your teams based on their facility and availability. This list here on the left, do not shake laundry, wear gloves, and so on, that is from the CDC. We've gone a step farther, and what we're going to do is our student athletes are all going to have their own mesh bag or loop that they put their laundry on. They're going to change, they're going to put their clothes on a loop, and then they're going to throw their own loop into the laundry. At the end of the day, or at the end of the session, when everyone's put their clothes in the laundry, the last person can start the machine, and that way no one has to touch anybody else's dirty clothes. Some teams are having their own students do their laundry in their rooms and buying them detergent, so you might hear some differences here. Locker rooms, we will be granting at phase 2 50% access to the locker room. maintaining physical distancing, but the caveat here is currently the governor is only allowing indoor mass gatherings of 10. So we will not have more than 10 people in a locker room or at any room at one time. Once we get to phase 3, we will still be continuing to maintain physical distancing of 6 feet within the locker rooms, and we will still be following gathering limits at that point. I don't know what those will look like. The governor has said he will update us. This current order expires on July 17th, so we will make the appropriate changes to that if we are going to progress to phase 3 at that time. Mental health. There's been a lot about mental health and COVID-19. Students have felt isolated. Their seasons were taken away. They haven't been able to see their friends, and so I wanted to put up a slide here of some of the resources available on campus through our counseling services here. They do telehealth appointments. They are located directly on campus. They're open 8:30 to 5, and then their contact information is here. This information was also shared in the team sessions, as well as some coping mechanisms for all of our student athletes in the interim until they arrive, and even for those that may not come back till August. I think the most important piece that the parents are going to be interested in is what happens when someone gets sick. So our plan, we're not going to have people report to the athletic training room or an athletic facility. The student athlete will be expected to call their athletic trainer. We'll do a screen over the phone, and if appropriate, we'll refer them to student health. Student health will be managing all testing and all diagnosing of our student athletes. If someone tests positive, at that point they will be placed into isolation. Isolation for summer session 2 is on campus at North College. They will be in isolation for at least 10 days until symptoms, from when the symptoms first appeared, 72 hours since the fever without medicine, and 72 hours after the symptoms have improved. So they will be in there for at least 10 days and potentially longer. At that point, the university and the county health department will initiate contact tracing and identify anyone as a close contact. Those close contacts will also be quarantined. They will be quarantined for 14 days. The difference between isolation and quarantine, I've had several people ask. They are very similar terms. Just isolate means those that are sick are placed in isolation. Those that have been exposed but don't have symptoms are placed in quarantine. But the idea is the same. The university will organize all necessary food, all necessary academic accommodations. They have an entire plan and algorithm that they go through for each student once they test positive. They will manage cleaning their room and sanitizing their spaces as well while they're in quarantine or isolation. Close contacts, who are close contacts? The definition that they're using, it's on a sliding scale, so it's time dependent. How long were you next to the person? How close were you with that person? Was there physical contact? Were you using PPE? What was the level of ventilation? Was it inside or outside? Did you pass them in the hallway? Did you have direct contact? So it's kind of a sliding scale to decide who these close contacts will be. Any of our student athletes that test positive or that have a suspected positive will undergo cardiac testing as well before they return to participation. This cardiac testing will consist of an echocardiogram as well as an EKG. Shared responsibility. This was something we've talked about with our student athletes and coaches. Everyone needs to do their part. You guys have all seen what's going on at other schools, particularly Clemson, with those student athletes going out to a bar and then coming back and having it widespread throughout the team. Regardless of how good our plan is, if we're not taking social distancing or wearing our mask seriously, we're going to end up in similar situations. And so we've really tried to hammer home that we need to model this behavior ourselves. Our student athletes will look to us, and they look up to us and what we're doing, and they're going to follow our lead. And so I ask the parents as well to try to set this lead and example of what it looks like. It's sacrifices that are being made. We all understand that. Some of them aren't fun, but some of these are sacrifices we need to make if we're looking to have a soccer or basketball season this year. These are several of the references that I've had. Then here's my contact information. For those of you that are on the phone, my office number, is 336-841-9275. 336-841-9275. Or you could email me. My email address is J as in Joshua and my last name Gerus, Gerus as in Sam, O at highpoint.edu. Again, that's jgeruso at highpoint.edu. That's all that I have. I'm checking the box here for any questions. I don't see any. I'll give you guys a few minutes if you have any questions or concerns about what I've said. Again, yep, go ahead. I see a question here. The question is, I would like to know if there will be a plan to speak with the players regarding healthy eating habits. We do not currently have that in our COVID plan to help boost their immune systems. We don't have anything like that in our current plan, but we do talk about general nutrition guidelines. That is a good idea to add. I will put that in. We have compliance meetings with these students when they arrive, so I will put that in there and add that as a piece of what we do. Thank you for your question. I have another question here. Will all athletes be tested when they arrive, or just those that flew there? The only athletes that we're testing at this point in time will be those that fly. The current CDC recommendations, they were actually updated yesterday, is not to do asymptomatic testing on the masses when they arrive. So we will not be doing that. The university is not doing that. We're trying to follow as closely as we can to the CDC guidelines in that respect. If an athlete is in isolation or quarantine, how will we receive information about the status of our child? The university will be handling isolation and quarantine. They haven't told me how they will communicate that to the parent. There are some HIPAA and FERPA regulations that they would need to work through. So let me ask them what their plan is, and when I send out this presentation, I will answer that question with some better information for you. I'm just writing down this note. Hold on one second. How will parents know? Next question. How long are the phases? Our phases, phase 2 will be as long as the governor has us in phase 2. So at a minimum will be from the time your student athlete arrives next week until July 17th. So it'll be at least right around 2 weeks. And then if the governor progresses to phase 3 will be a gradual increase in activity and contact and intensity of practice. Another question, you said they will be fed if in isolation. This includes getting enough liquids for them and medicine if needed. Yes, any of their hygiene needs will be brought to them, so they'll make sure they have enough soap and things like that as well. We have a question about parents' rights to be involved and informed regarding care decisions. Those, again, will be through the HIPAA concerns by by those laws, these students are adults, and so they will be under those protections as provided by the federal government. But again, I'll try to get some information to see how they can share information. I know many of our students share FERPA release forms, which allow us to have discussions that are outside of the norm. We also have some ability. Your students all sign waivers so that I can talk to you guys, talk to their parents. So if the university has some concerns about sharing information, we can come up with a system. You guys will know what's going on. Your student won't be in quarantine for 14 days without you being made aware. I got another question coming in. If acute care is necessary, who will be making those decisions? I'm assuming you're referring to if someone needed to go to the hospital. At that point, it would become an emergency situation, and we can contact emergency contacts. So if we are headed to the emergency room because someone is in that type of condition, you will certainly be made aware and be a part of those decisions and discussions. If the state starts shutting things down, what will happen if HBU closes for summer session? Do the athletes come home? I hope that doesn't happen. That's not our plan. We have students here that started on Monday. Things have been going pretty smooth so far this week. If the state shuts things down, we'll follow whatever their recommendations and guidelines are. And if they mandate that students return home, then we'll follow the direction of the governor at that time. What is the move-in plan? Do you mean on Sunday? What does move-in look like? Yes. Okay. They have a very similar type of move-in to what you guys are used to if you don't have freshmen, if you have returners. They'll be taking symptoms. They'll be doing symptom checks and temperature checks before you come onto campus, and then they'll still help you organize and get your stuff to your room. It's just got a few extra precautions, but it'll be familiar to you guys. What is the turnaround time? What is the turnaround time for test results when a test is given? At this point, we have been told that the turnaround time is 24 to 48 hours. We have not obviously had students here that we've had to send tests off for yet. Some of our colleagues at other institutions have said they've been told that turnaround times we're going to be in a day or two, but they've turned out to be 4 or 5. So we're not using that lab. That was who we were going to use, but because of that feedback, we've changed to a different lab, and we're confident that they'll be able to get our results in 24 to 48 hours. Any other questions out there? All right, seeing no more, that'll wrap up this evening. Again, please call me or email me if you have any questions. For one last time, my office number is 336-841-9275. and my email is jgeruso@highpoint.edu. Thank you guys so much for your time, and if you have questions, please do not hesitate to reach out. Oh, I got another question. If there is a positive case that needs treatment, would that be covered by HPU insurance or personal? That would be through your own personal insurance. You're welcome. All right, thank you guys so much. Contact me if you have any further questions. I appreciate your time.